everyone, and welcome to our Monday Minute. Today we're going to discuss open enrollment of the Medicare Advantage plans and the impact it could have on your agency, Home Health and Hospice. The Medicare Advantage open enrollment period is October 15th through December 7th. During this time period, any patient who is eligible for Medicare can make the decision to change their current coverage. They can go from one Medicare Advantage plan to another. They can go from a Medicare Advantage plan back to traditional Medicare. They can go from traditional Medicare to a Medicare Advantage plan. It is very crucial that your agency have the discussion with your patients during this time period that any decision they make must be communicated to you as their healthcare provider. It's imperative that they understand the significance of any changes that they may make. And it's okay for you to have the conversation with them if they ask you the question about whether they should do this plan or that plan. You, being a field staff member, possibly may not have all the necessary information, but someone within your agency may be able to answer their questions. This is a very important time as the changes that occur during this open enrollment period will go into effect January 1st. You do need to make sure that you are consistently checking Medicare eligibility verification on every patient you have that is Medicare age eligible in January at least once per week, to ensure that any changes are accounted for. That includes any patient that you currently have on service as we approach January 1st. This is specific to home health and hospice. Hospice is not immune to this, I guess is the word I'm looking for. Hospice now has to deal with Medicare Advantage in situations where the value-based insurance design model, or the VBID model, is currently active. Do know that there has been an update to the VBID model as far as the participants in the model for hospice in 2024. One of the significant changes is that United Healthcare has dropped out of the VBID model participation for 2024, which was over 25 Medicare Advantage plan packages. So agencies, hospices who currently have patients enrolled in United Healthcare that are in the VBID model, if those patients are still on service with you in January, you will continue to participate in VBID and bill United Healthcare. Once that patient dies, revokes the benefit, is discharged live for any reason, a new admission would go back to traditional Medicare. But as long as they remain on your service January 1st and later, if they were already in a VBID participating plan, whether it's United Healthcare or any of the others that dropped out, you will continue to bill that plan until, again, that patient revokes the benefit, is live discharged, or, of course, dies. It is imperative that you make sure your field staff and your administrative staff that have access to conversations with patients regarding this very important period of time, so that they are equipped to answer any questions that your patients might have and to gather the information of any changes that your patients may participate in. Understanding that if they do change to a Medicare Advantage plan and it goes into effect January 1st, you will be required to bill that Medicare Advantage plan January 1st and later, even if they were already on service under traditional Medicare before that point. Please stay informed, and please make sure your staff understands the consequences of responding or not responding to your patients appropriately. If Healthcare Provider Solutions can help in any way in navigating through open enrollment, please don't hesitate to let us know. Have a great week.